When managing conditions like tardive dyskinesia or TD, finding the right treatment can be life-changing. Tardive dyskinesia, a movement disorder often caused by long-term use of antipsychotic medications, has been notoriously difficult to treat. However, Ingrezza, valbenazine, has emerged as a significant breakthrough for patients dealing with this challenging condition. Approved by the FDA in 2017, Ingrezza offers hope for reducing the involuntary movements that disrupt daily life. In this video, we're going to dive into the top 10 facts about Ingrezza that can help you understand how this medication works, who it helps, and what you need to know if you or a loved one is considering it for treatment. Number 1. What is Ingrezza? Ingrezza, also known by its generic name valbenazine, is a medication designed specifically to treat tardive dyskinesia, or TD, a condition caused by long-term use of antipsychotic drugs. Ingrezza was approved by the FDA in 2017, giving people with TD a new treatment option that targets the root of the problem: excessive dopamine activity in the brain. By specifically addressing this imbalance, Ingrezza helps control the involuntary movements that are characteristic of TD. The approval of Ingrezza was a major step forward in treating TD, a condition that previously had limited treatment options. Unlike older medications that may cause additional side effects, Ingrezza was developed to directly manage the movements caused by TD, without interfering with the original psychiatric medications that patients rely on. 2. How does Ingrezza work? Ingrezza works by inhibiting a protein in the brain called vesicular monoamine transporter 2, or VMAT2. VMAT2 plays a role in regulating the storage and release of neurotransmitters like dopamine. In patients with TD, dopamine levels can become imbalanced, leading to involuntary, repetitive movements. By inhibiting VMAT2, Ingrezza helps regulate dopamine release and restores balance to the brain's movement control system. This precise action on dopamine is what makes Ingrezza different from many other treatments for movement disorders. Rather than broadly affecting all neurotransmitters, Ingrezza targets only the pathways responsible for TD symptoms, making it an effective and well-tolerated solution for many patients. 3. What is tardive dyskinesia and how does Ingrezza help? Tardive dyskinesia, or TD, is a movement disorder caused by long-term use of antipsychotic medications, which are commonly prescribed to manage mental health conditions like schizophrenia and bipolar disorder. TD manifests as involuntary, repetitive movements, often in the face, mouth, or limbs. These movements can be distressing and significantly impact a person's quality of life. Ingrezza helps by specifically targeting the motor symptoms of TD. It works to reduce the involuntary movements, offering relief to those who have struggled with the condition for years. While Ingrezza doesn't cure TD, it effectively manages the symptoms, improving the overall functioning of individuals who take it. Number 4. How did Ingrezza get approved? Ingrezza's approval by the FDA was based on robust clinical trials that demonstrated its effectiveness in treating tardive dyskinesia. These trials involved patients who had experienced moderate to severe TD and showed that Ingrezza could significantly reduce involuntary movements. The drug's relatively mild side effect profile compared to other treatments made it a promising option for those suffering from TD. Ingrezza's approval was a huge step forward for the treatment of TD, a condition that had been difficult to manage with existing medications. The approval process highlighted the need for more targeted treatments that could address the root causes of movement disorders without worsening other psychiatric symptoms. Number 5. What are the side effects of Ingrezza? Like all medications, Ingrezza comes with some potential side effects, though they tend to be mild for most people. Common side effects include sleepiness, fatigue, headache, and nausea. These are typically short-term and subside as the body adjusts to the medication. However, more serious side effects can include mood changes, depression, and worsening movement disorders. It's important for patients to consult with their healthcare provider regularly while taking Ingrezza to ensure the medication is working as intended and to manage any side effects. Overall, Ingrezza has proven to be well tolerated by most patients, with many experiencing significant improvements in their symptoms. We made a book, 10 Questions Everyone Should Ask Their Pharmacist. You can find a link in the description below. Feel free to check it out. Number 6. How should Ingrezza be taken? Ingrezza is taken once daily in capsule form. It's generally recommended to take the medication at the same time every day, with or without food. The dosage may vary depending on the individual's condition and the healthcare provider's recommendation, so it's crucial to follow the prescribed instructions carefully. For patients who have difficulty swallowing capsules, there may be alternative methods, such as opening the capsule and mixing it with food. However, it's important to consult a doctor before making any adjustments to the way the medication is taken. Number 7. How does Ingrezza compare to other treatments? Ingrezza is often compared to other medications used for treating tardive dyskinesia, such as xenazine, tetrabenazine. While both drugs are designed to reduce involuntary movements, Ingrezza has shown to be more effective and better tolerated by many patients. Its selective action on VMAT2 makes it a more targeted treatment for TD, whereas xenazine affects other neurotransmitter systems as well. This targeted approach allows Ingrezza to reduce the motor symptoms of TD without causing the severe side effects that some older treatments might induce. For many patients, this makes Ingrezza a preferred choice when compared to other available treatments. 8. Who can benefit from Ingrezza? Ingrezza is specifically designed for adults who have moderate to severe tardive dyskinesia caused by long-term use of antipsychotic medications. It is particularly helpful for patients who have not seen adequate results from other treatments or who have experienced intolerable side effects. It's important to consult with a healthcare provider to determine if Ingrezza is a suitable option based on individual medical history and current medications. For individuals suffering from TD, Ingrezza can provide significant relief from involuntary movements, improving quality of life. It's not suitable for everyone, however, so a thorough evaluation is necessary to determine whether it's the right treatment. 9. How much does Ingrezza cost? The cost of Ingrezza can be a significant concern for some patients. Without insurance, the medication can be quite expensive. However, most insurance plans will cover Ingrezza when it's prescribed for the treatment of tardive dyskinesia. It's also possible to find patient assistance programs that can help reduce the cost for those who qualify. If cost is an issue, it's a good idea to talk to your healthcare provider or pharmacist about potential financial assistance options. The manufacturer of Ingrezza also offers programs to help eligible patients manage the expense of the medication. Number 10. What does the future hold for Ingrezza? The future looks promising for Ingrezza, with ongoing research aimed at expanding its use beyond tardive dyskinesia. Scientists are exploring whether Ingrezza could help manage other movement disorders or be used alongside other treatments to improve outcomes. As more research is conducted, we may learn about additional ways that Ingrezza can be used to improve patients' quality of life. In the meantime, Ingrezza remains a crucial tool in managing the symptoms of TD. For many patients, it has made a significant difference in their ability to control involuntary movements and live more comfortable lives. As the medical community continues to learn more about the drug, its potential for further breakthroughs in neurological treatment is exciting. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications, and cheers to a healthy life.